Thank you, Ciaran Lynch, and I'd like to thank your office for facilitating this debate before the House this evening. Ciaran Lynch, there is a backlog of 4,478 orthopaedic patients on the waiting list at Cork University Hospital, and they have been on that waiting list for 2 years or more. The longest patient on the list has been there for 3.5 years. Each week, an average of 100 new patients are referred to the hospital. The average waiting time for what is described as a routine patient is 24 months, 2 years. A routine patient is likely to be an elderly person who will suffer routine pain every single day of the 2 years while they are waiting to be examined. During this time, pain management often has to be administered by their local GP while they await that first initial appointment with their consultant, and as a result, the quality of life for this person is greatly diminished while they are waiting for their procedure. Pain, for administration purposes, may be described as routine, but it is far from routine when examined in real human terms. And just this week on TV3, we saw an example of a woman who's on this waiting list who, rather than go through the daily grind of dealing with that pain, went to her local credit union, borrowed €5,000 and got on a plane to Poland to actually have that procedure carried out for €5,000. To take another example, a 72-year-old patient came to me last year, and he was classed also as a routine patient. He was advised that an urgent MRI scan was needed, but that it could not be carried out until the hip examination had been completed. This makes no sense whatsoever. Furthermore, patients classified as urgent wait an average of 18 months for an appointment at the CUH. It's hard to conceive how a patient classed as urgent by a consultant can be expected to go on a waiting list for so long. The National Outpatient Department, the OPD, project has been established to improve the delivery of OPT services, and I commend the medical staff that are making every effort to reduce the backlog, but the waiting times are still increasing. Comparisons must be made with the private sector, where it is commonplace for a patient to be treated for hip replacements in about 8 to 10 weeks. This suggests that there is a major organisation difficulty at the heart of the problem, and this was seen to be the case for a great number of years. Before the creation of the PRTB, the NTPF, the National Treatment Purchase Fund, we saw a situation in the CUH where patients were seen within 3 or 4 months. They may have been waiting 2 years for a procedure, but they were seen within 2 or 3 months. When the National Treatment Purchase Fund was put in place, those patients now have to wait for 2 years before they can actually get that first appointment, and if they're not treated, to be sent on to the National Treatment Purchase Fund. So there is something very, very worrying going on in the CUH, and it's been going on for a number of years at an administrational level, and it's something that needs to be sorted out. In other areas, the CUH has made improvements in progressing other areas of outpatient treatment. The same skills must be employed in improving orthopaedic services in the Cork region. Now, Ciaran Lynch, I share the Minister's objective of renewing the health service as laid out in the programme for government, but 4,478, mainly elderly patients, must not be expected to suffer in silence during this period of renewal, and I ask him to make these patients his priority. Thank you.
I will be taking this adjournment on behalf of my colleague, the Minister for Health. Firstly, I wish to say that this government finds the situation on waiting lists for orthopaedic services totally unacceptable. Patients need a service that is timely and effective. Statistics such as these prompted the Minister to establish the Special Delivery Unit as a priority. The SDU will focus in particular on those waiting for consultant appointments, as the Minister views the consultant appointment is the key to diagnosis and the treatment of a patient. Reducing waiting times for outpatient departments is a priority for 2011, in particular in specialties including orthopaedics with the highest waiting times in numbers. There are a number of encouraging initiatives underway in addition to the SDU to alleviate this problem. In the HSE South, these include the following: additional staffing, a physiotherapy initiative, validation of waiting lists, improved management of OPD processes, including reducing missed appointments and increasing the numbers of new patients seen at clinics. In the HSE South, there are 5 permanent consultant orthopaedic surgeons in post in the trauma and elective service, with 2 locum consultants in the trauma service. There are currently 100 referrals per week, and this has increased over the past 12 months, with 2 new permanent consultants providing revision surgery. HSE South has approval for 3 consultant orthopaedic surgeon posts at CUH South Infirmary, Victoria University Hospital. These are 2 orthopaedic surgeons with a special interest in paediatric orthopaedic surgery, new posts, and 1 orthopaedic general surgeon, which is a replacement post. Recruitment has been completed, and it is anticipated that formal letters of appointment will be issued soon. Physiotherapist-led clinics were introduced in 2010 to address the waiting list for OPD appointments. The physiotherapists triage patients based on the longest waiters, primarily from the hip and knee lists. 35% of the patients seen at these clinics were referred to an orthopaedic consultant for surgical review, and a review of this initiative has been completed in order to continue to improve patient flows. Approval for 3 additional physiotherapists under the outpatient programme for rheumatology and orthopaedics has been sanctioned, and these posts will allow for more musculoskeletal physiotherapy-led clinics. The recruitment process has begun. At national level, the Outpatients Department OPD Performance Improvement Group has been established to improve OPD services throughout the country. The project aims to address the significant numbers on waiting lists for some specialties. This project will standardise all aspects of OPD, including waiting list validation, management of DNAs, improvement in new to return ratios, and improved triaging. Cork University Hospital and South Infirmary, Victoria University Hospital have been selected to participate in the initial phase of this project. Cork University Hospital is undertaking a validation exercise on its OPD waiting lists. This exercise will link in with the national OPD programme on the validation protocol, particularly for the clinical governance process for removing patients from waiting lists and for GP involvement in the process. It is expected that this exercise will reduce the numbers on the waiting list. Under the reorganisation of acute hospital services in Cork and Kerry, electronic GP referral to acute hospitals is being piloted. This will enable more efficient processing of referrals and allow patients and GPs to see waiting times for individual consultants. I believe that the implementation of these initiatives will greatly improve waiting list numbers, and the Minister and his officials will be closely monitoring the situation to ensure that these statistics become a thing of the past.